Hello everyone, welcome to my channel CodeMed Mastery. Today let us discuss anatomy important questions and answers part 2. Previously I have made part 1 video, so I request you to check it out. So let's start today's video. Oxygenated blood is carried to the heart by which of the following structures? Option A aorta, option B carotid arteries, option C inferior vena cava, option D pulmonary veins. The right answer is option D pulmonary veins. Next question. Which of the following substances is found in greater quantity in exhaled air? Option A carbon dioxide, option B carbon monoxide, option C nitrogen, option D oxygen. The right answer is option C nitrogen. Next question. At which of the following location does bile enter the digestive tract? Option A gastroesophageal sphincter, option B duodenum, option C ileocecal, option D jejunum. The right answer is option B duodenum. Next question. The thoracic cage is a structural unit important for which of the following functions? Option A alimentation, option B menstruation, option C mentation, option D respiration. The right answer is option D respiration. Next question. In men, which of the following structures is located at the neck of the bladder and surrounds the urethra? Option A epididymis, option B prostate, option C scrotum, option D seminal vesicle. The right answer is option B prostate. Next question. A patient sustains severe blunt trauma to the left upper abdomen and requires surgery. Which of the following organ is involved? The right answer is option D spleen. Next question. Which of the following terms describes the motion of bending the forearm towards the body? Option A abduction, option B eversion, option C flexion, option D pronation. The right answer is option C flexion. Next question. Respiratory disease that causes overexpansion and destruction of the alveoli is known as? Option A emphysema, option B respiratory distress syndrome, option C pneumoconiosis, option D cystic fibrosis. The right answer is option A emphysema. Next question. If the foot is abducted, it is moved in which direction? Option A inward, option B outward, option C upward, option D downward. The right answer is option B outward. Outward movement is always termed as abduction. Next question. Which of the following cavities are separated by the diaphragm? Option A abdominal and pelvic, option B cranial and spinal, option C dorsal and ventral, option D thoracic and abdominal. The right answer is option D thoracic and abdominal. Next question. Which of the following anatomical regions of the abdomen lies just distal to the sternum? Option A epigastric, option B hypochondriac, option C hypogastric, option D lumbar. The right answer is option A epigastric. Next question. Which of the following is the master gland of the endocrine system? The right answer is option D pituitary gland. Next question. Which of the following is structural fibrous protein found in the dermis? Option A collagen, option B heparin, option C lipocyte, option D melanin. So the right answer is option A collagen. Next question. Calcium, potassium and sodium are classified as which of the following? Option A androgen, option B catecholamines, option C electrolytes, option D estrogens. The right answer is option C electrolytes. Next question. Where is the Warthin tumor found? Option A back of eye, option B bone, option C salivary gland, option D ovary. So the right answer is salivary gland. Warthin tumors are found mainly in salivary gland, that is in parotid gland, which is one of the salivary gland. Next question. What is thrombophlebitis? Option A swelling of extremities due to swelling, B inflammation of heart valves, option C inflammation of veins associated with formation of blood clot, option D constriction narrowing of valve. So the right answer is option C inflammation of veins associated with formation of blood clot. Next question. When patients have ERDS, which system is affected? This is actually ARDS, that is acute respiratory distress syndrome. So the right answer is option D, respiratory. Next question. The outermost layer of the skin is called? It is epidermis, outermost layer of skin. Next question. Which bone is located in the lower extremity? Option A, ulna. Option B, femur. Option C, humerus. Option D, radius. The right answer is femur. Option A, C and D, all these are upper extremity bones. Next question. The mediastinum is? Option A, both the lungs and heart. Option B, a small endocrine organ behind the heart. Option C, a location in the chest bounded by the sternum, diaphragm and lung. Option D, a part of the lymphatic system. So the right answer is option C. Mediastinum is a location in the chest which is bounded by sternum, diaphragm and lung. Next question. Blood flows from the right ventricle of the heart into which of the following structures? Option A, inferior vena cava. Option B, left ventricle. Option C, pulmonary artery. Option D, pulmonary veins. The right answer is option C, pulmonary arteries. Next question. Saliva contains an enzyme that acts upon which of the following nutrients? Option A, starches. Option B, proteins. Option C, fats. Option D, minerals. The right answer is option A, starches. Next question. Which of the following describes the cluster of blood capillaries found in each nephron in the kidney? Option A, efferent arteriole. Option B, glomerulus. Option C, loop of Henle. Option D, renal pelvis. So the right answer is option B, glomerulus. The glomerulus contains cluster of blood capillaries. Next question. What is meningitis? Option A, inflammation of ventricle of the heart. Option B, enlargement of lymph node in the neck. Option C, swelling of the brain. Option D, inflammation surrounding the brain and spinal cord. The right answer is option D, inflammation surrounding the brain and spinal cord. Next question. Which of the following conditions is characterized by incompetence of the esophageal sphincter? Option A, Crohn's disease. Option B, esophageal varices. Option C, gastroesophageal reflux disease, GERD. Option D, pyloric stenosis. So the right answer here is option C, gastroesophageal reflux disease. Next question. Which of the following best describes the process whereby the stomach muscles contract to propel food through the digestive tract? Option A, absorption. Option B, emulsion. Option C, peristalsis. Option D, regurgitation. So the right answer is option C, peristalsis. Next question. Which of the following organ removes bilirubin from the blood, manufactures plasma protein and is involved in the production of prothrombin and fibrogen? Option A, gallbladder. Option B, kidney. Option C, liver. Option D, spleen. The right answer is option C, liver. Next question. Which of the following structures is a part of the small intestine? Option A, ascending colon. Option B, cecum. Option C, ileum. Option D, sigmoid colon. The right answer is option C, ileum. Ileum is the final part of the small intestine.